Hey guys, Andrew Lee here, the health insurance guy, and I just want to make a quick video about Medicare and how this all works. And I want to make this very simple, very easy for you guys to understand because I know there's a lot of moving parts with Medicare. If you've dealt with Medicare, you know what I'm talking about. It's hard for some beneficiaries, and I totally understand. It's not your job to understand this stuff. It's mine, right? So that's why I'm going to go ahead and just do a quick overview and not spend too much time on it about how Medicare works and what plans are available. So Medicare is comprised of Part A and Part B, right? So let's not get confused with all the letters, but Part A and Part B together equals original Medicare, which is that red, white, and blue card people get when they enroll into Medicare. So Part A is technically for hospitals, and Part B is technically for the doctors that fill the hospitals. Now, you can have original Medicare. The only problem is if you have original Medicare by itself, it only covers 80% of doctor visits in hospitals, right? It doesn't cover medication, which, as you guys know, if you guys are on a tier 4 medication, if you guys are on a medication that is maybe outside of the formulary, you know how expensive medication can get, right? So here's sort of the why we need to plug up that 80% is because, God forbid, if you go to the hospital for any reason and you just had original Medicare, then you're on the, let's say you had $100,000 bill. It's not so hard to rack up $100,000 bill these days. It just really isn't, right? So if you have $100,000 bill, then you're on the hook for 20,000 of it. And it happens every time that you have to go into the hospital. It's just not like a one time out of pocket maximum payment. You have to pay that every single occurrence. If it's $1 million, you're on the hook for 200,000. So it's a very uncomfortable place to be, especially if there's a hole in the coverage, if there's a gap, we need to fill it with something. So and especially we need to get a drug plan involved as well too, because original Medicare does not have a drug plan involved in it. So there's two options you can go with, right? Let's say this is a T chart. On this side, let's call it Medicare Advantage. On this side, let's call it Medicare Supplement. So Medicare Advantage is the product that you guys see on TV with all the old football players and Jimmy from Good Times and and all those people from well back when, talking about $0 plan this. You get all the free rides this, and you get free doctor visits, $0 for your dental and OTC benefits and your gym memberships and all that good stuff, right? I mean, it sounds good and all, but for people who qualify for a Medicare Advantage, are going to be the following. It's going to be people who are used to more of the HMO system because generally it's more like an HMO system in our area. So if you're used to that and you don't have 17 specialists you have to go to, then great. A Medicare Advantage might be a good fit for you. Also, a drug plan is going to be built into the policy as well too. So if you sort of wanted like an all-in-one, and it's also a $0 premium by the way too. So the only thing that you do have to pay is the Part B premium, right? And everybody has to pay that unless you're on Medicaid or Medi-Cal. So everybody does have to pay that, be it whether it comes out of your Social Security or if it comes out of your actual bank account and you did like a routing and account number and you did reoccurring payments quarterly, right? That's how Social Security would accept payments for Medicare Part B. Once you have your Part A and B set up, then you can enroll into a Part C. There's just specific enrollment periods where you can make this change. The annual election period is from October 15th to December 7th. So that's generally, when everybody is, sort of scrambling for finding a new plan and also finding a policy that's going to keep them up for the rest of the year or for the rest of their lives, right? Depending on, how good the plan was and how good the experience was with it. Now, with somebody that has about 17, if I ask somebody, hey, how many doctors do you go to? And they give me like 7 doctors and they're not in the same medical group. Like for Medicare Advantage, you have to be in the same medical group. The doctors all have to align in the same medical group. But if you have a primary care physician over here and a specialist over here and another specialist over here and another specialist over here in 4 different medical groups, it's pretty hard to align all 4 doctors in one medical group. So they might be better served doing a Medicare supplement plan, also known as Medigap. So those are like the Plan Gs, the Plan Ns. Again, I'm not going to confuse you with the alphabet, but With the Medicare supplement, the pros are you're free to roam. About 97% of doctors that take original Medicare is going to take the same exact plan, right? 97% of doctors do take this. So free to roam. All you're responsible for if you're on a Plan G is your your deductible, and that's pretty much all you're responsible for. Outside of that, everything is generally going to be $0. Also, prescription drug plans are not covered or not built in like a Medicare Advantage plan. You have to get a standalone prescription drug plan. So if you're working with an agent like me, we got to do two things. We got to find you a policy that's going to cover your supplement, and then also a policy that's going to cover your drugs. And if you need a dental vision, things like that, of course, we can customize it from there. So those are sort of the pros and cons. If you're more on the I don't take that many medications, or I mean, even if you do, it's still going to be a good plan. But I don't have that many doctors, and I'm okay with the HMO kind of system. Generally in our area, that's just what it's going to be. Then a Medicare Advantage is going to be a great fit for you. If you're on the other side of the fence, where again you have so many doctors that you have to go to, and it's imperative, it's life or death that you have to go to these doctors, then you're probably going to be on more of a Medicare supplement candidate. There is a premium associated with Medicare supplements, so that's just again the pros and cons between the two. You got to pay to play over here, right? I mean, if you're going to see all the doctors that you want to see, you do have to pay the money. Here, I mean, you can still find the doctors that you want to find. It's just a matter of, they all have to be in the same network. If they are, great. It's an all-in-one kind of plan, and you can still have, the doctors that you want to go to in your same medical group, so all will be well. So that's sort of just the breakdown about Medicare. If you guys have any more questions, feel free to give me a call at 323-844-8471, or you can even email me at info@healthmutualnetwork.com. Thank you, guys.